Hi, I'm Dr. Felice Gersh, your integrative OBGYN, and I want to take a few minutes to talk to you about a very timely topic, GLP-1 receptor agonists and pregnancy. Now, whether you're interested in getting pregnant or not, this little conversation I'm going to have with you is actually really important because by looking at what happens when women are trying to get healthier, to prepare for a pregnancy, and then they become pregnancy, and how it revolves around what happens to their bodies after they have been using GLP-1 receptor agonists applies to women at other stages of life as well. So there are lessons to be learned about what happens in pregnancy. So let's talk about GLP-1s. And I'm going to say GLP-1s, but just so you know, the drugs that are GLP-1 receptor agonists, that is semaglutide. That is the one that, actually there's oral versions. I'm not going to go into oral versions. So, but the semaglutide is what is a GLP-1 receptor agonist. Now, it's not actually a GLP-1. It's a mimic, but it binds to the receptors for real GLP-1s and activates the receptor. That's why they call them receptor agonists. Now, the other drug that's very popular now, Tirzepatide, is actually a combination of a GLP-1 receptor agonist and a GIP receptor agonist. But I'm not going to go into what exactly that all means. Let's just talk about the drugs you know. Tirzepatide, also known as Mounjaro and Zepbound. And then we have, Wegovy and Ozempic. That's the semaglutide. So I'm going to just call them by their generics if I talk about them. Okay, so now let's talk about women who use them prior to becoming pregnant. Well, it's a very common thing now for women across the entire spectrum of life, from young adulthood on, to be using these drugs to try to get healthy, to lose weight, to deal with insulin resistance. And now there's a host of other things, reducing inflammation, pain, to reduce addictive behaviors, improve cardiovascular status, as well as the standard, which I mentioned, reduce weight and insulin resistance improvement. So what about using these drugs to become more fertile? Well, it turns out that males as well, we're not going to talk about males, but whether you're a male or a female desiring pregnancy and you have these metabolic dysfunctions and then you go on these drugs, it does definitely, as a general statement, increase fertility significantly. Now, what about weight loss? Well, that's part of it. Losing weight just by itself, no matter how you lose weight, is a very big impetus to improving fertility. Obesity is really harmful for fertility. And then so is insulin resistance. So all the different things that actually are beneficially impacted by these medications will improve fertility. Now, what if you don't want to become fertile in terms of you don't want to have a baby? Maybe you want to be fertile for the future, but you don't want to have a baby now. Well, actually, you might accidentally become pregnant if you're a female, or help a woman, or not help if she doesn't want it, to get pregnant if you're a male. So it's really important to be aware if you're not interested in pregnancy and you think, well, I'm not very fertile, I can be a little risky in my behavior. You will potentially get pregnant. We'll just talk about women here. Yes, you might get pregnant when you don't want to get pregnant. What if you use oral contraceptives, pills, birth control pills? Well, it turns out that one of the mechanisms for weight loss of these pharmaceuticals is by significantly slowing the emptying of the stomach of its contents, aka food, okay? Well, if you're not going to empty your stomach and digest the food in a more rapid way, well, when you swallow a birth control pill, you're not going to essentially digest it and get it absorbed into your bloodstream as well either. So birth control pills become less effective in women who are using them for contraceptive benefit. So It's really important if you are a woman who is using one of these medications and you're on birth control pills to use another method, like a barrier method, like a condom or a diaphragm, because they may not work. And then you'll have an accidental pregnancy or use something else altogether if you don't want to use two things. So it's important to know that birth control pills, talking about swallowing them, may not be properly processed through the digestive tract to create the benefit of creating temporary infertility. We don't want to have babies when we're not ready for them. Well, let's get back to the women who want to get babies and they really want to be fertile and they also want to have an uncomplicated pregnancy. Because what's the whole point? You want to be fertile, to get pregnant, have an uncomplicated pregnancy. You don't want the baby to be negatively impacted, to have poor growth or deliver really prematurely. And as the mom, you don't want to have a lot of problems. You don't want to have gestational diabetes, hypertension, preeclampsia, placental abruption. You don't want to have any of those physical problems, which can, by the way, haunt you later in life, because we now know pregnancy is the ultimate stress test for women. When you have a bad outcome, any kind of complication, you actually have a higher risk of having problems, cardiometabolic problems later in life, particularly through perimenopause, menopause, and thereafter. So having a healthy baby is the goal, along with a healthy mother, of having a pregnancy. We do not consider a success if you deliver a baby 3 or more prematurely. If you have severe complications, the baby has lifelong problems, and the mother is ill and ends up in the intensive care unit. No, that is not a success. That's not our goal. So what about using GLP-1 receptor agonists to become more fertile? Because you want to have a baby. You want to lose weight. And of course, women that I deal with all the time, polycystic ovary syndrome, PCOS women, they often are overweight. They often have irregular cycles and a very high rate of infertility and also pregnancy-related complications. Well, here's the story. We now know that women who are infertile or have reduced fertility because of cardiometabolic issues like insulin resistance, diabetes, obesity or overweight, inflammation throughout their bodies, and so on, that if they go on these medications, the GLP-1 receptor agonists and related like Tirzepatide, they will become more fertile. In fact, some women become really fertile and get pregnant very quickly. And there's a name that was given. They call them Ozempic babies because, wow, of course, it doesn't have to be Ozempic. That's just kind of the name that was kind of given, that they go on these medications and oops, wow, they're pregnant with no effort, which sounds great. But let's talk about the consequences. And this is really telling. Remember in the beginning, I said, this talk is important whether you are planning to become pregnant or not, because it gives us a look into what happens when you discontinue these medications. So what's the recommendation? That any woman who wants to get pregnant who is on these medications stops using them at least 2 or 3 months prior to trying to conceive, or to become actively involved in trying to make a baby, because we don't want women to conceive while on these drugs. But if that happens, then we want them stopped as soon as possible. As soon as you know you're pregnant, you have to stop them, which means you can't wean down off of them. So if you do stop these medications, which is what is absolutely the standard of recommendation prior to actually trying to become pregnant, because when you are on these medications, you become much more fertile. So as soon as you want to become pregnant, you have to be already off the drugs. The recommendation is not to stop these drugs abruptly, but to wean down. And there's no exact protocol. Maybe, cut the dose down over time, over a month or two, cut the dose down each week that you use it, that you get the injection, and then maybe spread out how often you get it instead of weekly, maybe make it every week and a half or every 2 weeks, if possible, to kind of help your body adjust by weaning down. But if you become pregnant or you're in like a super rush to get pregnant, then you stop it abruptly, okay? If you know you're pregnant, you stop it, because we don't have for sure knowledge of what happens if a woman is on these medications and she is pregnant. What we have is a number of observational studies where women who were pregnant and didn't realize that they were pregnant and they were on these medications, and then they looked at what happened. So the good news is they haven't seen any signs of long-term harm, but we don't have long-term data. So, immediate harm they're not seeing, but long-term we don't know. And also, these are just observational studies with very small numbers. So if you're pregnant, you stop them. If you want to get pregnant, you stop them even before you try to get pregnant, preferably by weaning off. Now, what happens when you get off these medications, whether abruptly or by weaning off? What happens then when you're pregnant with these medications? Well, here's the problem. When people are on these medications and then stop them, however they stop them, and we don't have a lot of data on weaning off, but when people stop these medications, they will regain the weight that is lost, and they will become metabolically unhealthy again. And this has been shown time and time again in all the studies. Now, can there be an exception to the rule? Could you be that exception to the rule? Maybe, but I go by medical probabilities. The odds are, if you go off these medications, you will regain the weight, and rapidly. What they have shown is that if two people started at, say, 200 pounds, they both lost 50 pounds, one through these medications, the other through the old-fashioned way, diet, exercise, and other lifestyle modalities. They lost 50 pounds. So 200 to start, matched people the same otherwise. They lost 50 pounds. Now they both fall off the wagon. One stops the medication, the other one just goes back to the old eating habits. What happens? The one who was on the GLP-1 receptor agonist and lost 50 pounds will regain all the weight in half the time as the other person who lost the same amount of weight, but using the old-fashioned, diet and exercise, etc. This is really horrific, to think that you lose all this weight and then really fast you regain it. That is not a good thing. So as a general statement, if you go on these medications and some of the results are really transformational, you have to think of them at this time. Maybe it'll change, but based on everything we know, as lifetime commitment to stay on these medications. But if you get pregnant, you have to go off of them. So what happens in pregnancy? The same thing. If women go off of them while they're trying to conceive, the weight comes back really fast. And if they find out they're pregnant and then they instantly go off of it, they also gain the weight back really fast in pregnancy. The weight comes right back on really fast. And when they've shown women at the same weight who become pregnant, the weight gain during pregnancy is substantially higher in the women who lost weight prior to becoming pregnant using GLP-1 receptor agonist medication. So weight regain is really a big problem during pregnancy and prior to pregnancy once these drugs are discontinued. And what kind of weight is regained? Well, if you look at what weight is lost on these medications, much of the weight, not all of it certainly, but anywhere from 2 to 40% of the weight lost is lean body mass, primarily muscle mass. And when the weight is regained, whether it's in pregnancy, prior to pregnancy, or unrelated to pregnancy at all, when you have the weight regain, it is rapid, and generally speaking, it is adipose tissue regain, fat. So when you lose the weight, you lose muscle and fat, more fat than muscle, but also muscle. When you regain, it's all fat. And the metabolic dysfunctions that people had, like say they had PCOS and they had insulin resistance, maybe they had some degree of hypertension. So the cardiometabolic problems come back fast as well. So it's a real problem at any time. But what about in pregnancy? What happens when women go off these medications, which they have to at this time, and then they regain weight really rapidly in pregnancy, and they're more prone to getting back their old cardiometabolic ills. What happens to the baby? Well, the babies tend to get heavier as well. So there's more fat deposition accumulation in the babies. What about the mom? Well, women who become pregnant after they go off of the GLP-1s have a significantly higher rate of every pregnancy complication compared to other women who start pregnancy at the same weight. And even women who have the similar medical problems, but they never went on the GLP-1 receptor agonist. So say you have two women with polycystic ovary syndrome, and they both weigh 200 pounds, but one lost weight the GLP-1 receptor agonist way, the other one lost the weight, like say the same amount of weight, whatever it is, through diet and exercise. And then they both start pregnancy at the same weight, but one had just recently, like maybe a few weeks ago, gone off the GLP-1 receptor agonist. What about their complication rate during pregnancy? The women who went off the pharmaceutical, the GLP-1 receptor agonist, they have in the neighborhood of 33 or so percent higher rate, higher incidence of basically every pregnancy complication, whether it's gestational diabetes, preeclampsia, gestational hypertension, preterm delivery, much higher rate of delivering a very premature baby. So what's the takeaway from all of this? Well, it's a problem. I think first we need to acknowledge that women can do great and get more fertile, lose weight, improve their insulin sensitivity. Everything is good, but then they have to go off of these medications. Then everything is not so good. And they have much higher rates of pregnancy complications. The babies put on more fat. The women gain so much weight so quickly, back again, and it's mostly fat. So they actually have more metabolic problems and all of that because now they have less muscle. Muscle is what burns glucose, and now they have less of it. So they may be, and this has been shown, metabolically less healthy than before they lost the weight in the first place. No one knows what the right answer is for this group of women who want to get fertile, want to get healthier, want to do it through the use of GLP-1 receptor agonists, and then get pregnant and then have all these problems. This is not a good solution. So I think, and I'm open to change, and I want to see some new and more data, but that women who want to get pregnant in the future, that they seriously consider not going on these medications and work really hard with diet and lifestyle, because I know that people can lose weight. I'm not saying it's easy. I'm not saying it's perfect. I'm not saying everyone will get absolutely to goal. But if women eat a very healthy, plant-focused diet, mostly plants, very little animal protein, they work on sleep and stress and avoidance of chemicals, work on their gut microbiome, work on stress reduction, all the lifestyle things that we talk about day in and day out, and maybe go on other medications, but not GLP-1 receptor agonists to help them lose weight. There are other drugs on the market that can help. Great, not great, but not terrible, and not drugs that have these lasting effects like through the pregnancy that can change the life of the woman going forward and change the life of their offspring. Because remember, we want a healthy mom, we want a healthy baby, we want a pregnancy without complications. These are not hard and fast rules. Like I said, I don't know the answer. I'm hoping maybe it'll turn out that it will be safe to stay on GLP-1s through pregnancy. I don't know. But the answer right now is it's a risky business going on these medications before you become pregnant. What about the message to people who are not ever planning on pregnancy because they either don't want them or they've already had all their babies? Plan on staying on these medications for life. That's not a terrible thing. They can do wonderful things, but don't go off of them, because don't think you're the exception to the rule, because this is some of the concerns, okay? Like, why are these problems happening in pregnancy? What's happening to the GLP-1 receptors or the production of GLP-1? Why are things so much worse in women who become pregnant, who go off of these drugs? Well, it may be, and there's just theories right now, no proof, nothing for sure, that these medications may alter your own production. Our own GLP-1 producing cells no longer produce. They may be suppressed by the medication, and maybe it'll come back or maybe they won't. We don't know. Are they suppressed for 6 months, a year, 5 years, forever? We don't know. But it may be that being on these medications suppresses your own ability to make GLP-1 from your own cells that normally make them. Or maybe the receptor for these GLP-1s is modified by these chemicals that are GLP-1 receptor agonists. They're GLP-1 mimics. Remember, they're not real GLP-1s. They're mimics that bind to the receptor and activate it. Maybe they modify the receptor so that when you go off of them, your own produced GLP-1s no longer work optimally or at all. We don't know. So the bottom line is there's so much more to learn about these medications. But based on what we currently know, if you go on them, pregnancy is not on the horizon ever, okay? Ever. Just plan to stay on them for life. There are many medications that are for life. That's okay. Don't think you're different than other humans, okay? Medical probability is that you're like other humans and you will regain the weight and pretty rapidly when you go off of them, and you'll be less metabolically healthy. You'll lose muscle, you'll regain all fat. Your body will work less well. You'll be more metabolically unhealthy than before you even went on the medication. Just plan on staying on it forever. If you're a younger woman who wants to have children in the future, please think twice about going on these medications. It may be a real problem for you when you want to become pregnant. We only know what we know now. There are other ways to lose weight and be healthy. I deal with it all the time. Honestly, I've seen people lose weight. I'm not saying it's easy, that you ever are cured. It's not a cure. And that's important to know. When women lose weight and they go to, great lengths to lose weight, it's not a cure when they reach their weight goal. They are always going to have to be working on this. Consider obesity, PCOS, lifelong conditions that need to always be treated in some way. You're never cured, but you can be in remission, but not cure. There's a difference. You always have to be on guard. So just be aware. GLP-1 receptor agonists can be fantastic drugs for many people, but we still don't know so much about them. So in summary, they can lead to great results, but if you go off of them, you will regress to where you were or worse. You will be regaining the weight, mostly fat. You'll be metabolically less healthy than before you started. And if you want to get pregnant, you're going to more likely than not gain all the weight back or more and have a very significant risk of having pregnancy-related complications and having some issues for your baby that maybe didn't have to happen. We're still learning, but being aware is where you start.